at Mybreast. What we wanted to do is to create Harley Street quality at an affordable price. All the surgeons are all of the highest standard in terms of training. We work at private hospitals of the very highest standard. The doctor-patient relationship is the most important and most fundamental aspect of patient care. You will remain in the care of your doctor, of your surgeon, and this is lifetime if necessary.
The term blepharoplasty really refers to operations to try and rejuvenate the eyelids. Perhaps in the past, blepharoplasty meant, and perhaps it still does mean to many people, removing eye bags. And of course, eye bags are commoner in the lower lid, where often you see protrusion of what is actually fat from behind the eye, making the eyelids look baggy. In the upper eyelids, it's often less about fat, but more about extra skin, so that you get little folds of skin in the upper eyelid. So blepharoplasty relates to a number of procedures that help in this area. Eyelid surgery can be carried out under local anaesthetic, although many patients prefer a short general anaesthetic. The incisions are usually made in a skin crease, and in fact for lower eyelid surgery, often the incisions can be made actually within the eyelid, on the inner side of the eyelid, so that there's no visible incision on the outside at all. It's very important when we talk about blepharoplasty to get away from the commonly held assumption that this is a very simple, straightforward procedure. In fact, nothing could be further than the truth, and blepharoplasty is an operation that requires extremely careful assessment and examination before considering to carry out the procedure. Far too many people in the past have had blepharoplasties which involve taking out too much skin from the lower eyelid in particular, and this can give rise to not just a slightly starey or obvious look, but can give rise to considerable problems with the function of the eye. So although blepharoplasty can be a terrific operation that really makes a big difference to rejuvenating the eyes, it is one in which the utmost care has to be taken to make sure that the patient is appropriate for the procedure and that the procedure is appropriate for the patient. It may be more appropriate, particularly for younger people, to have a brow lift. And brow lift these days can be carried out through a little keyhole surgery with two tiny incisions, very simply, to give, I think, a more natural result than often a blepharoplasty can do. Recovery from a blepharoplasty is relatively quick, and certainly patients get over the surgery within a few days. But anyone having a blepharoplasty needs to have their eyes carefully looked after. The eyes can be a little sore or a little red or a little gritty afterwards. Sometimes for a period of a week or two, you don't blink as quickly as you should do, and you may find that the eyes become irritated much more quickly. It should be said that although you recover very quickly, it may be that you get some bruising, and that bruising can be a little persistent and last for up to 10 days or 2 weeks. The result will often give rise to a sort of fresh appearance, and also by taking out extra skin from the upper eyelids, particularly for women, it means that eye makeup can be applied much more successfully. So it gives a nice, fresh, lighter, more youthful look to the eyes.